Dr. Timothy Strauman is a PhD and professor of psychology, neuroscience, and professor at the Department of Psychiatry and Behavioral Sciences. He is also affiliated of the Duke Initiative for Science and Society and the Duke Center for Child Family Policy and co-director for the Centers on Addiction and Brain Change. In addition, Dr. Alison Adcock,
assistant professor and member of the core faculty in psychiatry and behavioral sciences, an assistant professor of neurobiology, an assistant professor in the Department of Psychology and Neuroscience, and a member of the Center for Cognitive Neuroscience. What I've done, I put together a list of questions, and we're going to be going back and forth between Dr. Strauman and Dr. Adcock with some questions about the brain that I've put together. So I guess I would like to begin with Dr. Strauman. Could you respond to the question, what is your neuroscientific response to the statement, you have the power to change your brain?
Hi, good morning. I have a couple of responses. One is it's sort of interesting to be thinking that my brain is contemplating whether and how it can change itself, which I think is probably, on one hand, illustrates all the complexities involved, but I think it also illustrates just how wonderful brains are and what amazing capacities they have. And I was especially impressed with Brandon's remarks about, all of the things that we take for granted and all of the things that our brains do for us. I bless you. I sort of think of it as a healthy functioning brain recedes into the background. Okay. A healthy functioning brain recedes into the background. So you don't, when it's working the way you want it to, you don't ever have to think about it. It's beautiful. It's like the transmission in your car, right? It's in the right gear, depending on what speed you are, everything's cool. There is so much work going on right now that I think the answer is, do we have the power to change our brains? Yes. Will we have the power to change our brains infinitely, any way we want, any time we want? Probably not, because brains are unbelievably good at staying focused on what they already know how to do. But I think the answer is clearly yes, and I'm excited to be a scientist at a time when the scientific community is really starting to take this question seriously.
Thank you. Thank you very much. Dr. Adcock, what is your neuroscientific response to the statement, you have the power to change your brain?
Thank you. Well, this is a question that I think about a lot. I think, can people hear me without the mic?
Okay,
Yeah,
great.
so I'll hold one mic. Yeah. So my entire research focus is directed at this question of how we can optimize the plasticity in mainly adult brains. The things that we study are relevant to young people and children, but the capacity for plasticity is really the central focus of the work that we do. And I think, building on what Tim said, the capacity changes over the course of the lifespan, and it changes in really interesting ways, right? So when you're a young person, when you're a baby, what we know is that the brain is busy just sucking up things indiscriminately from the environment, right? So you have to learn how language is put together, you have to learn how people interact with each other, how physical objects move through the world, and all of that just kind of hits the brain in a way that's completely, as Tim said, invisible, right? It just gets in without really much effort. And then as the brain knows more and more and more competency in different places, it gets more and more constrained, which is helpful because it gets more efficient. So then you shift from this kind of indiscriminate sucking up of information from the environment to learn things. It matters if you care about them, right? So the brain selectively pulls in the information that's relevant to things that in your history have been important to you. So I think that's an interesting constraint that we can capitalize on. and one that keeps the brain from just washing out in all the experiences. So those are the boundaries on how much the brain can change. And so what we're learning now is how to take advantage of the systems that facilitate change at all these different stages of life. And they're different, right? They're different mechanisms, and they have different limits on them in brains that are brand new brains, just putting together how the world is, to older brains that are figuring out what they want to do, to older brains that have done a lot of what they want to do and want to keep doing it better and better.
This question is for you, Dr. Adcock. How would you define neurological change as a neuroscientist, and what are the best methods to achieve neurological change based on some of your research?
So, as I said in the answer to the last question, it depends, and it happens at multiple levels. So we can think about change in the cells in the brain and how they function. We can think about change at the level of how the cells are talking to each other and which cells are talking to each other. So we talk about that as systems plasticity or network or circuit plasticity. And we can think about change in the rhythms of the brain, how they're waxing and waning, and the arousal states are waxing and waning. So all of those are different ways of describing or analyzing how the brain is changing. And one impacts another, right? So if we talk about the definitions, we have to define it at all of these levels and relate it to behavior to really understand it. So that's one reason it's complex. But fortunately, we can pick one and intervene, and it affects all the others. So we can pick a behavioral intervention, and it affects all the others. It affects the system, it affects the circuits and the dynamics, and the cells themselves at the neurotransmitter level, the chemical level, right? So even though we have to think about all of these levels of analyses, we can intervene at any of them and see an impact. And so our job is to figure out which is the one that's going to have the most of what we want to happen, what kind of intervention we need.
What is some of the real specific research that you're doing? I'm just really interested in some of the core research that you're involved in. You have a laboratory, actually, that you manage. I'd like to hear a little bit about your laboratory.
Yeah. So we're interested in matching the kind of plasticity that needs to happen to the behavior that's required. So for plasticity and learning processes that are about expanding your repertoire or doing new things, probably you need a state of motivation. So I made reference to the idea that wanting or things that are important to you are how we get the brain in gear to learn for adults, right? I mean, and true all along the lifespan, but especially true for adults, right? If we want to prevent behaviors, if we want to have behaviors stop because they're really dangerous, then we can engage fear systems, and those kinds of behaviors are more likely to stop suddenly with fear motivation. The brain gears up to detect things rapidly and make really simple kind of cartoon-like responses of, my usual example is a bus. It's big, it's yellow, it's moving at me. You don't really need to know how the bus is put together or the gears work. You just need to know these basic things about it, right? So you can encode that kind of information really rapidly when you're in fear mode. When we're trying to be more flexible, which is the case a lot of the time for adults, then that kind of learning mode is actually usually counterproductive because you want to think about things more complex and put together relationships and learn new ways to do things. These simplified representations get in the way of seeing new ways to do things. So we study how those different motivational states relate to what gets learned and how it's represented in your brain, what kind of memory traces are made, and how it fits with individuals' personalities and stages of life and moment in time. And this is work that we do in collaboration with Tim's lab, which is really focused on the kinds of motivations that individuals find most helpful. We're also interested in how we engage these systems intentionally in helping people learn about what it's like to feel motivated in one way versus another way, because it's not something that a lot of people have practice with. Maybe athletes tend to practice how to get themselves in gear, but the rest of us may or may not do that. I can talk more about that if it becomes relevant. But.
Dr. Strauman, what methods have you developed or are currently researching to improve brain function and human behavior? I know that you were doing a lot of similar work together, but you have your own distinct research that you're doing.
Sure. So let me take about a 30-second detour, which actually hopefully is relevant. So my last name has the word trauma in it, which apparently, I don't know if any of you noticed that or not. I actually didn't notice that until I was an adult. Although, really. And the only thing I remember is when I was a kid, I used to go to the family doctor, and he had a row of books up on the shelf, and one of the books was called Trauma. And I'm looking at it, what is it about that word that I've seen before? And it's sometime when I was in graduate school, it finally hit me what it was about that word. Hopefully I'm not quite as clueless in the science that we do, but there are a couple of things about that example that I think are important. One is that there is so much that brains are already doing constantly in the background. So you've probably heard of what people call the cocktail party effect. So if you happen to be in a group of people and somebody on the other side of the room says your name, your attention is immediately drawn away from what you're doing here to that conversation, which means your brain was listening all along. It also means your brain was listening in a really efficient way because you were having a conversation that was going perfectly well, and your brain's doing all this other stuff in the background. That was sort of my introduction to why the brain was so interesting back when I was a graduate student, just those kinds of seemingly trivial things. But they're actually not trivial, and one of the things that Alison pointed out is that the more we learn about how those things happen, the more we can use that knowledge, not just as scientists, but basically as people, to rid ourselves of habits that we don't want, to understand how we might respond in a situation before we respond rather than after. So there are these emerging technologies, really, where we're combining what we've learned about the brain with things that people can do for themselves intentionally. Mindfulness practices are a terrific example of that, and I really enjoyed the opportunity just to get about 5 minutes of beautiful, mindful relaxation because I happen to be a pretty anxious person, and anytime I can get it is a good thing. One of the things that we're doing in our lab is, and I know this is going to sound really simple-minded, and it's not rocket science, but we study depression, and if one treatment for depression is good and another treatment for depression is good, what if you were to actually combine them? Would that actually sort of make it any better, right? Like I said, not rocket science. But there really is some intricacy in how you would combine them and why you would combine them and how you would do that. So some of the research that I'm involved in right now, in addition to what Alison's talking about, is to combine transcranial magnetic stimulation, which is nothing more than using a magnetic field to sort of innervate the surface of the brain, with psychotherapy that is actually supposed to be engaging the brain circuit that you're aiming the magnet at. So, this is the sort of thing that probably, a 5 or 6 year old could come up with the basic idea of, but believe it or not, nobody's ever done that. Nobody's ever tried to say, we know that TMS is helpful for depression, and we know that these cognitive skills are helpful to depression. Is there some way we could possibly make them a little more synergistic? So part of what our lab is doing is simply exploring whether that's something that's useful. Where that actually might be helpful in a broader context is, what if doing that actually augments people's ability to make that brain circuitry more efficient? Okay. So, any of you who've worked with somebody who had a stroke, I remember when my dad had his first stroke, it was a real eye-opening experience in terms of learning what the individual brain circuits do and learning how to compensate for them and learning how to sort of re-engage them again. And in a sense, the research that we're doing is really analogous to that. It's, taking a situation like depression where the brain is not doing what we want it to be doing, and in using the knowledge that we have to try to sort of focus multiple different methods, multiple different pathways to get it to go back to doing what it what it is we really want it to do. So for me, that's very exciting, and we are really at the beginning stages, but we're very enthusiastic about it.
Dr. Adcock, how does trauma, such as traumatic brain injury, affect the brain in terms of cognition and emotional response?
So I don't think there's a single answer to that, right? It depends on what areas of the brain are injured, how severe the injury is. But I think one illustration of how delicate the brain is as a system and how limited our understanding is at present of the different ways that it can be injured is that for traumatic brain injury, as opposed to stroke, the idea that we really need to push people to really exercise, it has a different implication. So in both cases, you have a brain that has an injury. It's a point in time. You can pinpoint when something happened, right? But the most helpful thing for stroke seems to be to really get people to start doing things and start engaging plasticity very early. And that doesn't seem to be the case for traumatic brain injury. And I know I have someone that I work with quite closely who was struck by a car in the fall. And I interacted with the neurologist a lot to try to help get her life back on track as quickly as possible. And we all had to be very careful because she was a very motivated young person who wanted to be doing things really quickly, and she was bored, and she wanted to really get back up and not sleep all the time, right? So, but in that case, the sleep is part of the plastic process and seems to be one of the most important things for people who've had an impact injury, right? So I think the idea that there is a single thing that's going to be helpful in all cases, even where there's a pinpoint in time injury, we need to be very careful about. And I'm not a neurologist, and it's not my expertise. And in fact, I knew that my inclination was to try to help this person be doing things as quickly as possible, and that might be the wrong approach for her. And that was confirmed by the research that the neurologist shared with me. So I think we also need to include the idea of rest and reparation and be respectful of how taxing these plastic processes can be. So that's the big caveat to how much plasticity is that there may be cases where really pushing people looks like it might work against them because they really need rest as well. So figuring out that balance between rest and repair and when is the right time to engage the plastic processes is also really important. And I think I want to make sure that everybody takes that away, since some of the focus here is on brain injury. So that said, it's clear that the more we give people to do when the time is right, the more they can do going forward. So really staying in close touch with the occupational therapists and the physical therapists and the people that are working with the brain to get it doing its job again as soon as it's safe to do so is, I think, the bottom line for everybody in the room, right? And knowing when it's safe to do so, I think, is something that's still really being defined by the science. We've got a lot of epidemiologists and other people paying attention to how things go for people who've had injuries. So there's also the sort of, as you included in the question, the emotional responses to now I have a new body, a new brain, right? And how does that change who I am in the world and what my identity is and what I'm capable of? And I think there's no reason to temper the idea that motivation and engagement in your life are helpful, right? So we might want to put the brakes on it to make sure that people rest properly, especially teenagers. But it's really clear that having an awareness of what capacity is there and how, and not putting limits on what can be done over time with work is a helpful concept, right? The idea that there is plasticity, there is hope for new capacity and capability is certainly useful to people who are trying to recover, and we have biological evidence of that. So that's one of the things that my lab studies, which is the idea of optimism and capacity and empowerment and hope have a signature in the brain. And it's a signature in a particular system, the dopamine system and other systems, and we can watch it turn on when people think about things that inspire them. Okay, so those ideas have a direct impact on the nervous system, and they're helpful for the kinds of things that are required for incorporating new abilities.
Dr. Strauman, could you distinguish the difference between the brain and the mind?
No.
Yeah.
Honestly, if I could do that,
I know.
I'd already be a statue somewhere. I'd be a Nobel Prize winner. I can assure you that's not going to happen. This is obviously such a big, complicated problem, and to me, I think what Alison was just talking about is probably as good a way to distinguish as any. I like to think about the mind as sort of, a person's presence in the world. And we know the mind is present in a number of different ways, and a lot of those ways are implicit. We don't have to pay attention to them in order for them to work. Brains and minds have this wonderful capacity that we can decide to focus on something and trust the brain to do all the other stuff that we're not focusing on, right? So right now, you're all sitting in a chair. You know from your own experience that you don't need to focus on the sensation of sitting in the chair because it's not relevant. You're here to do something else. There are other times, though, maybe about a half an hour ago, when focusing on the sensation of sitting in the chair was relevant, and it's wonderful to be able to go back and forth like that. I think of the mind as the way that the brain engages with who I am and who you are. And it's hard to say much more about it than that. One of the things that we've learned is that it's very easy to take for granted a totally healthy brain, and it doesn't take much for people to do sort of take a step back and say, oh my gosh, I have been taking that for granted. And, we heard two very courageous stories earlier today about people who've had to fight to regain all of those abilities. The brain is very plastic and the mind is very powerful. And they talk in ways that we are only now beginning to understand. I think probably if I were going to say one thing that would be a take-home message is I'm not as convinced that we even need to distinguish them anymore. I think they really represent different ways of understanding human experience. And sometimes it's better to operate at one level of analysis, and sometimes it's better to operate at another one, and sometimes it's better just to stand back and be in awe of the entire thing.
Dr. Adcock, this is actually a question for both of you. How is what is being called a mind-body and holistic understanding of the brain different from traditional scientific ideas about how to address problems with brain function?
I'm still thinking about what Tim is saying, and I think that the distinction, I'm not sure that there is a useful distinction between mind-body approaches or interventions and the way neuroscientists have been thinking about the brain and the mind relationship to the brain for a long time, except that in the same way that language within a particular field helps people communicate, right? So if you're a body practitioner and you want people to sit up straight, like I imagine my yoga teacher talking about the string attached to the top of my head and making it go to the ceiling. And that sits me up straight better than any other image or communication that I can think of, including align the muscles along your spine and use your cerebellum to do. I mean, none of those things are helpful, right? So the communication is in the image, and that's the way to think about, I think, the mind-body distinction, is that there are things that we can use. Kids pretend to be castle guards in order to focus. They pretend to do lots of things in order to assemble all of, in these very intuitive ways that Tim has been describing, all of these images that help you regulate your behavior, and that's what your brain is built for, right? So thinking about it as a language distinction as opposed to a thing, an actuality distinction, I think is the way that is most helpful to me. But there is this funny thing about intervening that I think people thinking about scientists thinking about the brain often assume that we are really reductionist and that the brain explains everything, and if you could just place every atom where it was supposed to be, then you would account for all of our behavior, and there's no free will and nothing interesting in the world, right? And I don't think any of us believe that, but there is a problem of when you're sitting in a room with someone and you ask them to do something, right? What is that? You say, try to imagine a string on the top of your head, and then I do it, right? How does that happen? How does it happen that someone states a goal and then another person absorbs the goal? How is it, so if you want to talk about free will or things that operate independently of minds, that's usually where people go. Then I decide to sit up straighter in using the tools that someone gave me. So I think this interactions between minds, between brains viewing the world is one of the most interesting things that we do, because it means that all of the determinism of atoms in one particular body, right, and how they're aligned is depending on another one and its view of the world. So you've got these interesting sources of noise and subjectivity, and it might be true that if you had one single brain in the entire universe and it was just interacting with atoms, there would be no chance processes or sort of pushing it one way or another, and it would be a very boring system. But that's not what we do. We interact with all these other brains that are absorbing the information from the world, right? So I think everything that we're doing is about that, of brains interacting with other brains and their views on the world and their experience. And that's why it's so interesting and exciting and unpredictable to think about these interventions. Is that? Yeah.
About how to address problems with brain function. Do you want to expand on that?
Sure. I'm going to take a slightly different approach because I think Alison just summed up the neurophilosophy very as well as I've ever heard anybody do it. Both of our previous speakers were talking about real-world frustrations with getting the health care that was needed and getting that health care paid for. And one of the real ironies about this is, and this has been, if you'd ever taken a class from me, you've heard me get on my soapbox and rant about this, but if any of us have a heart attack, not only will our insurance company be willing to pay for an entire range of services that covers really every aspect of human experience, knowing that it's cost effective for them to do that because that will be the best way to get us to recover. Not only are they willing to pay for it, but they'll get very bent out of shape if we don't do it, right? And rightly so, because recovering from a heart attack is something that needs to be addressed at multiple levels, and all of the levels are valid and all of them are important. And there's not a lot of scientific debate about that now. And insurance companies have gotten very savvy to the fact that not only is it good for the patient, it's good for their bottom line. I mean, imagine that. Someday, that will be true for mental health-related issues. It'll be true for traumatic brain injury. But right now, it's not. And to me, I think one of the things we can do as scientists, and one of the things we all can do as consumers, is make it very clear that the research is saying exactly the same thing. Exactly the same thing. So some of the work that I've been doing clinically is working with older folks who have chronic pain issues, who have occupational injuries and so on, and simply can't work anymore. And if you were to ask them, what's the worst part about your life situation? Many of them would not say it was the pain. They wouldn't say it was the lost income. They would say, I don't know who I am anymore. I spent 30 years at this job. I have colleagues. It's how I raised my kids. It's how I put a roof over my family's head. It gave me meaning. Now, because of this chronic pain, I need to find the meaning all over again. And I can tell you, and this isn't going to surprise you, that the only thing that's going to make the pain manageable is to have a new way of thinking about the meaning of your life, right? And the people that you know and I know who have transcended those kinds of traumatic, life-altering medical events do it in part because they are able to find a meaning, something that gives them the strength, something that gives them the optimism, something that gives them the hope. And yes, as we learn more about how that happens in the brain, it's absolutely remarkable to see, that the systems really do fit together. Mind and body are not pulling us in opposite directions if we're getting the right kind of care that we need. So, obviously I'm preaching to the choir here, but this is something I feel really strongly about, that it's ironic and unfortunate and totally inappropriate that in areas where the mind-body interaction is most obvious, those are the ones where politically it has been hardest to get people the care that they need to bounce back from that. And my prayer is that someday there will be true parity across all the range of different kinds of medical problems that people are seeking help for. And I think organizations like NAMI and what goes on in Durham County here are huge steps in that direction. So believe me, my hat is off to you. And I think you are the cutting edge of the mind-body revolution. It's certainly not me. I think it's you.
Thank you very much for that answer. Thank you. Dr. Adcock, what are some common questions you have heard about changing the brain you would like to answer?
I think we've talked about a lot of my favorite questions already, but I think the one that seems the most important is to follow up on what Tim was saying about what there is support for in our systems. So I think the demand for behavioral interventions that are ongoing and the medicalization of change processes are sort of opposing forces in our systems, but ironically, the more we can talk about how the brain is important to these things that we know, like people need to work to feel, have goals, and that those things are good for their psyche and for their bodies, right? The more we demonstrate how wired that is into the brains, the more people get in our medicalized systems, the more credit they give these problems. It's very ironic. I wish we were smart enough to figure out another way to make the case, but the system for a long time, that our cultural system has had a very monetized view of meaning and productivity and prosperity, right? So I think really, I just want to endorse, more than answer a question, the view that these things that we do interpersonally and behaviorally are as important as anything we can do with a drug or a device for changing the brain.
Thank you. Back to Dr. Strauman. The same question. What are some common questions you have heard about changing the brain you would like to answer? I know you've already spoken so much, but is there anything else that you'd like to say?
Yeah, this is fairly limited, and I mean it in a sort of a joking way. The question is, should I go onto Lumosity.com and train my brain? The answer is sure. Why not? You should also play a musical instrument. You should read for several hours a day. You should exercise. You should meditate. You should appreciate beauty and music. You should carry on stimulating conversations with people you love. You should do all of those things. Just don't pay any money to do them, because you don't need to. If we're talking about specialized care, that's a different subject. But if we're talking about keeping your brain as healthy as it can be, this is one of those areas where your grandmother actually was right all along. And how you do it is really not all that difficult. What's difficult is doing it. And But, so by all means, do anything you can to train your brain. But don't get carried away with the trendiness of it. I mean, everything you do changes your brain. That's what your brain is supposed to do. Everything you learn, everything you remember. One of the beauties of Alison's research is it points out that how much memories are constructions of things rather than just really literal little recordings of things. This is a recording. Memories are not like that. Memories get put together when we need them, and we can learn to put them together in lots of different ways. So, yes, and I'm not a stockholder in Lumosity.com or anything else. Yes, do everything that you like that stimulates the brain, because it really does make a difference. Just don't pay for it.
Okay. Can I follow up on that? Sure, go ahead.
So I think, and there are I think you can think of therapy exercises, really targeted exercises that find a weakness or a specific desired strength and train for those skills, right? So we can use devices or other things to train specifically for those skills. That's not really what Lumosity was doing. It was like, everything will get better if you do, right? So the problem with many of these very focused things is generalizing to general brain health. And so that's the thing that's really a bad bet. There are isolated examples of computer-based training, just like there are isolated examples of physical therapy techniques that help, right? We target and we get better on that one thing. Those are safe bets, and that should be undertaken in conjunction with someone who is skilled to identify the path and help you pick the tools. And everything else, as long as Lumosity is okay, as long as you're not sacrificing many other things to that, with the idea that the whole brain will get better, because that's a hard thing to accomplish.
Thank you. Thank you. Let's go back to Dr. Strauman. I have one last question for both of you. As a neuroscientist, what is it about the brain that surprises you?
I would have to say, and this is sort of a personal reflection, and it's totally trivial, but I don't mean it that way. The thing that surprises me is how I can go 30 or 40 years not having heard a song, hear the song, and instantly have access to all the lyrics. Where has that stuff been for 30 years? My kids know that my mind is a vast wasteland of trivial information, and I try to get them to sort of tolerate it by saying, yeah, but isn't it cool that it's been in there for half my life, never came out until I needed it, and then the split second I needed it, it came out. Someday, I think we will have a clearer understanding of that, but to me, that's just actually remarkable. It's remarkable when it happens, and it's remarkable when it doesn't happen. I will never cease to sort of laugh at my own, just how much junk is in my head, how old most of it is, and how much I wish I could remember the things I need on a daily basis and not have to deal so much with the things I don't need, but that hearing a song kind of brings back up. So I'm certainly somebody who has some serious brain training to do in terms of disciplining my mind, but that, to me, has always been the singular thing. That's what got me interested in psychology, was just that phenomenon of where is this stuff when I'm not thinking about it, and how is it that it pops out? And, my neuroscientist friends who do that kind of work tell me they know the answer, and I'm sure they do, but I just like to wallow in the mystery of it sometimes.
Yeah, I don't know if we know the answer, but yeah, it is really remarkable. I got out a Joan Baez album that my mother used to play when we were riding in the car, and I just all the words, not anywhere for 30 years, and then and my kids were like, do you know that song? Yeah, so, but I think it also illustrates how many different layers of information and function there are. And so my answer is that, the cells are the same. In a given moment, the cells are different cells from the cells that recorded that song 30 years ago upon hearing it many times in your mother's car or whatever in order to get it memorized, right? But But there are new cells that have taken over the function. They're not the same cells that recorded it. And similarly, in a moment, you've only got a set of cells, but they change their function really dramatically depending on whether you suddenly got startled or saw someone you recognized, right? So those same cells are reconfiguring into a new network on a moment-to-moment basis. And we can watch that happen. We can use our brain imaging and recording techniques to watch it happen. And people using simple systems like crab ganglia can watch it happen when you squirt a chemical. Suddenly different neurons are talking to each other to do something different, to swallow instead of move your tail if you're a crab, right? But it's the same neurons. So that the flexibility and function that is accomplished with what's basically the same physical presence is, endlessly miraculous to me. So it's wonderful to be able to think about it.
Thank you so much for thank you so much for answering these questions that I put together. Just amazing, incredible information that you're sharing with us. Now I want to turn to questions from the audience.
I have a couple and you're talking about traumatic brain injury here, but in psychosis, if you have a psychotic break, what parents especially, we have a support group for parents, don't understand is the time it takes to recover from a psychotic break in terms of energy and the whole bit. And to them to say it may take 2 years before they're ready to be pushed instead of, just let them heal. It's just a new concept because it's so different from most physical illnesses except traumatic brain injury or that sort of thing. And but it takes also the system a long time to learn that, because they used to let like a schizophrenic person with a psychotic break stay in the hospital for a couple of years. But now it's almost impossible to get that kind of treatment. But it does take a long time. And I wanted to ask you about the brain games on TV. Have you ever watched those things? There's a whole program called Brain Games, and they do these fantastic little things, and they have you interact with them and try them out. What do you think about that sort of thing?
So I do a little bit of work both clinically and in my research with patients with schizophrenia and clinical high risk for schizophrenia. And I did a lot of it during my training at UCSF. And the people that I worked with at UCSF are actually some of the developers of brain games that they've used for schizophrenia. So that is a case where there is, I think, robust evidence of clinical improvement with targeted games. And again, those are games that cover a large spectrum of social function, working memory function, really thinking about all of the things that need to be addressed very specifically. But your starting question about why it is that people have a break and then they stabilize in a new state is one of the main reasons that I got into the research that I do, which is it's not just a chemical imbalance, because if we just got the right chemicals and sprinkled them on in exactly the right way, people would recover. And we see that a little bit more with bipolar disorder that has this waxing and waning thing, and if you just get them tuned right, they can stabilize at close to what they were doing before they got sick. But psychosis, often, as you point out, there is a break, an event, and then people take a long time to reconstitute after that. And understanding the plastic process, the learning that happens, we could call it bad learning, but it's the brain settling into a new equilibrium, right, that it's hard to get it moved out of. And so I think understanding all of these, what we call neuromodulators, the neurochemicals that change the state of the brain, are necessary because the brain is undergoing plasticity when people are having these really traumatic brain states, I think is a way to think about it, that they don't unlearn when you give them a drug, right? So I think thinking about it in a parallel way to the way we think about traumatic brain injury, as you did, is is probably very useful. That there's an injury and we need to think about stress management in the wake of that injury, or repair and restoration, and push. So not 2 years of hospitalization where people aren't in their lives, but a slow, gentle, how do we get them doing what they want to do and recover the motivation to do what they want to do while not increasing the stress that we know is bad for learning under those circumstances is, I think, our job. So,
No.
Hi, it's a little bit of a complicated question. Are you doing any studies on CTE, for instance? Just, that would be like maybe the number one.
I have nothing. There are studies that you can.
I have just become involved with a group that's actually led by a sociologist who is a former NFL player. And I think you're starting to get connected with this too. And so what's interesting to me about it is that people are already thinking about CTE from a much more holistic perspective because we've had the opportunity to learn from the TBI recovery literature about how important it is to be holistic. I mean, this is all work in its infancy, but it is at least going to happen.
Going from schizophrenia diagnosis 5 years ago, psychoses, and now more cognitive tests on my son, finding out that possibly there's a brain injury involvement. That's why I came today to see if I could find out more, because I'm his advocate, obviously. And I feel like we're a little bit at a standstill. It's just so hard, so complicated. It's so, I don't really know always the right direction to be going in, because one causes depression and one causes symptoms, and they're intertwined sometimes too.
So this is a new diagnosis in your family? Yes. So maybe, yes, with multiple different diagnoses recently, but the first diagnosis was quite recently. Yeah. If you'd like to talk separately afterwards, I'd be happy to.
You're talking about trauma that's related to physical issues, and I wondered if you had any information about the trauma that's imposed by the use of chemicals or, substance abuse. Is there any retraining approaches that are specific to that?
So this is an area where I think there's some remarkable work being done. One of the things that, there are so many different substances and stimuli behaviors that people can become addicted to. And it's been interesting to think about, what do those all have in common? One of the things they all have in common is that most of us want what we like and we like what we want. Okay? And you can think about problems like addiction as suddenly liking and wanting no longer fit so well together. So if you know someone who's struggled with substance abuse for a long time, they will often say, there's a part of me that doesn't really want to do this anymore. I know ultimately it's not something that's good for me, but I can't stop the wanting. I've stopped the liking, but I can't stop the wanting. And it's clear that deep within the brain, what has happened has been a sort of a dissociation between two things that most of us actually take for granted, and that we're able to use to sort of keep ourselves healthy. What to do about that? Now, having that realization, now we're in a position where we have some more options about what to do about it. But I think it's pretty clear that that's a helpful way to think about what addictions are and why people who are struggling with addictions don't seem to behave in ways that people who are not struggling with addictions. There's actually a really good reason for that. And I think part of the process of recovery is to understand that at a very profound and personal level. And, whether it's a 12-step program saying I am powerless to, more of a sort of a current scientific view, which is I don't like it, but I still want it, and I don't know how to rein those things in. For better or for worse, I think we're also on the cusp of much more effective, holistic ways of helping people with addictions, too.
So I think I'm a little stuck on whether we call addiction trauma. I mean, I think it's disruptive, right? But I think the sort of specific idea of trauma as an event that happens in the, addiction, because it develops in most cases. I mean, there are some examples of people who have an experience. Crack cocaine is one that people describe this way. Heroin is one that, that suddenly reorganizes. Most of the time it's, in other cases with nicotine and other things, right, this sort of gradual shaping of preferences. And I think one of the exciting things that, so then the preferences sort of become something, they become very narrow, and then they may even subside and become habits that have a life of their own, that don't even end up in pleasure in the same way anymore. But one of the things about treating addictions as brain processes has been that typically the approach to craving and the drive to get the substance has been to try to tamp it down and resist it, right? So we have some sophisticated ways of saying, okay, you're going to get in trouble, so back out and arrange your life so that it doesn't happen, and also simultaneously try to get rid of that urge, get rid of the wanting somehow. But I think something that is emerging from our research and other research is that you can think of the spectrum of people's drives and preferences as a bell curve, right? And so most of us have a pretty broad bell curve of things that we like and don't like and enjoy and pursue. But when in addiction, that becomes like a spike. Instead of this nice broad spectrum of things that people enjoy, it's very narrowed and it drives behavior in a very specific way. Okay, so one thing that we're investigating, we have these tools now for increasing motivational systems and their activation. So one question is, if we try to spread out people's motivational responsiveness to its former gentle slope of range of things that are interesting instead of the narrow one of cigarettes or the things that are driving the behaviors, can we increase the flexibility of the behavior in a way that wasn't really coming out of the efforts to resist urges or depress the urges? And some of the neurofeedback literature follows exactly this pattern. When people were instructed to try to reduce their cravings, they don't do a very good job at it. It's very difficult to manage to do that. When what you do instead is say, think of other things that you might like to pursue and elaborate those and experience the pleasure and practice doing that experiencing, then that looks like it might actually be easier for people to accomplish and potentially more sustainable as a treatment.
What do you guys think about the new grow new brain cells? Have you heard about that? How they're really...
I've heard people talk about it. I think, yeah.
Is there anything to that? Is that even possible? Because I always heard that once they're gone, they're gone.
So there are a couple of places in the brain where there are always new ones. The hippocampus, where we make memories, and which probably is involved in reproducing melodies from a long time ago, makes new brain cells all the time, and that may be one of the ways that antidepressants work, is to increase neurogenesis in the hippocampus. But the cortex and other places in the brain, we don't see that same thing happening. So with respect to a few places in the brain, like the hippocampus and a few other places deep in the brain, there certainly are new brain cells, and we're growing them a lot. So to the extent that that's what is being discussed, it's true. Other places like motor cortex and other cortical regions, probably not.
Thank you so much. I'm going to go ahead and turn the mic over to James Osborne.
I had a question about neuroplasticity and damage in the basal ganglia or the cerebral cortex. Specifically, I work with people with the beginning stages of Huntington's disease or even Alzheimer's. Is there anything that you do in your research to address neurodegenerative?
The research that my lab has been doing is more specifically related to, so it's in the dopamine system, which is involved in both Huntington's and Parkinson's, and also probably depression and addiction and schizophrenia. Not as much in Alzheimer's disease, although the approaches that we're taking may offer some benefit for those systems as well. They're not directly the disease focus. I think it's not clear how these plastic processes would be protective for many of the disorders, and in particular, if there's a strong genetic program in a cell, it's not clear whether the kinds of motivational circuitry would be enough to overcome that. But there is, as you know, in all of these diagnoses, a course that is malleable and is variable across individuals. So even Huntington's, which we know we have the gene, we have the protein, right? And there's still some variability in course. So I think the science for the future can capitalize on what modulates the course and establish what is the boundaries of how much influence we have on the course of the illness as a way potentially of developing new therapies that could be curative. Is that getting at the heart of your question? Yeah.
So my question was actually to Brandon and Nina, based on what you've been hearing about Tim and Alison talk about. I guess I'm just curious from your perspective, what was kind of the take-home part of the message and information provided? What, from your perspective and your life experience, what part struck you?
Well, I was really taken when they talked about rest being necessary for recovery, because when I was in a coma for like 6 weeks, but then it took another 6 weeks where I just slept the whole time, and they could tell I was awake from my coma by machines, but I slept the whole time, and I really think that really helped me to regain some brain function, and I really appreciated the talking about doing things for yourself. You need to really be positive and let yourself really feel like that you can do something, that you're contributing towards something, and put yourself in a mindset that you are being productive. And I think that's really important in making yourself feel like I can, and the attitude and stuff. I think that's just so crucial in recovery. But again, as I was saying too, it's been 25 years and I'm still recovering. I'm never going to recover, but I'm going to be recovering for the rest of my life. And so I just want to continue to be positive and just think that things are going to improve for me as I continue to try, So I really took that from what you guys were saying.
It was very inspiring to hear you talk about purpose, Dr. Strauman. I don't know if I would have the tenacity with my low brain function to do what I do and show up for work and keep creating new systems and new remedies and new relationships if I didn't have this nonprofit project with these kids in Africa to always be depicting that there's this vast range of expression, all across the globe. So, and also to hear that there's this lovely appreciation for a much more holistic approach to helping folks with what they've got, that they don't have to pay money for, that they can be inspired and motivated.
So I'm here to provide your closing remarks and also an encouragement and to get involved, and ways in which we can rise to a challenge, and ways in which we can continue this conversation going. Because just because it is Brain Awareness Day or month, this is an ongoing conversation that we need to continue to have.